Why loneliness, especially among older men, is becoming an epidemic. Loneliness is a pervasive problem in our society, affecting people of all ages and backgrounds. However, it is particularly acute among older men, who are increasingly at risk of social isolation and loneliness. This epidemic has far-reaching implications for individuals, families, and communities, and it is time to take action to address this pressing issue. Loneliness can be defined as the subjective feeling of social isolation or disconnection, and it is often accompanied by feelings of sadness, anxiety, and despair. According to a study by the University of California, loneliness is as dangerous to health as smoking 15 cigarettes a day and is more harmful than obesity. It is a risk factor for a range of physical and mental health problems, including depression, anxiety, heart disease, and dementia. Despite the growing recognition of the importance of social connections for health and well-being, older men are increasingly at risk of loneliness. A study by the AARP found that more than one-third of men over the age of 45 are lonely, and the problem is particularly acute among men who are divorced or widowed. One of the reasons for this trend is the changing nature of social relationships. As men age, they may lose touch with friends and family members, particularly if they are retired or have experienced significant life changes, such as divorce or the death of a spouse. Moreover, older men are less likely than women to seek out social support or to participate in social activities, which can exacerbate feelings of loneliness and isolation. Another factor is the way that society views masculinity and aging. Men are often socialized to be independent, self-sufficient, and emotionally stoic, which can make it difficult for them to ask for help or to seek out social connections. In addition to this, older men may feel a sense of shame or failure if they are not able to maintain their independence or if they are struggling with feelings of loneliness. The consequences of loneliness among older men are significant, both for individuals and for society as a whole. Loneliness can contribute to a range of health problems, including depression, anxiety, and cognitive decline. It can also lead to social withdrawal, which can further exacerbate feelings of isolation and disconnection. Furthermore, loneliness can have wider economic and social implications. Older men who are lonely may be less engaged in their communities, less likely to participate in volunteer activities, and more likely to rely on social services and healthcare resources. This can place a burden on families, healthcare systems, and social programs, and can have a ripple effect on the broader economy. Addressing the epidemic of loneliness among older men will require a multifaceted approach. This includes efforts to raise awareness about the problem, to reduce stigma around seeking help, and to promote social connections and engagement. Community-based programs that provide opportunities for social interaction, such as senior centers, community centers, and volunteer organizations, can be effective in reducing loneliness and isolation. Healthcare providers can also play a critical role in identifying and addressing loneliness among their patients. Routine screening for social isolation and loneliness, along with interventions such as counseling, social support groups, and referrals to community resources, can help to address this pressing problem.